bem-vindo ao nosso terceiro e último dia do nosso Encontro Nacional dos Programas de Pós-Graduação em Doenças Tropicais. Eu tenho o prazer hoje de trazer o professor Lehana Tabani, do Canadá. O professor Lehana está com 2 horas de delay antes da gente, lá são 7 da manhã, então eu já agradeço ele por acordar cedo para estar nos atendendo. Então, a partir de agora, eu vou passar a falar inglês para me comunicar com o professor Lehana e a sua apresentação. Sintam-se à vontade em fazer as suas perguntas em português, tá? Que a gente traduz e passa para o professor Lehana e ao final a gente faz uma discussão. Ele tem muita experiência com clinical trials. Okay, Professor Lehana, thank you again for your attention with us to participate of our meeting. Let me introduce you for our audience. Professor Lehana Tabani is Professor and Interim Chair, Department of Health Research Methods, Evidence and Impact of McMaster University, and Director by Statistical Units, the Research Institute of Joyce Hamilton. His research interests include clinical trials, pragmatic trials, pilot and feasibility trials, report of trials, systematic review methodology, and mentorship. Lehana is a member of International Statistical Institute, elected member, American Statistical Association, International Society of Clinical Biostatistics, the Society for Clinical Trials, and the Statistical Society of Canada. He is a member of the working groups for the consorted extension to pilot trials and the consorted extension to trials using cohorts and routinely collect health data. Having mentored more than 100 masters, PhD, and postdoc trainees, Lehana has won many teaching and mentorship awards, and he is the clinical member for CRHR. He has co-authored more than 600 publications in peer-reviewed journals and more than 700 abstracts presented at national and international meetings. And please, Dr. Lehana, introduce yourself. If you are, I forgot some part of your brilliant curriculum. Take your time. If you comfortable to share your screen anytime, and please go ahead. Thank you again.
Thank you again. Really, let me first do the first things first, share my screen, because this is the most important thing.
Okay.
Let's see whether I'll be able to share my screen.
Perfect.
I hope you're able to see it.
Great. Please click on hide. No, yes, hide. Yeah. Perfect. Good.
Fantastic. Well, thanks to the magic of technology, sometimes we get trouble. We got a little bit of trouble, but we managed. Welcome, everyone. It's very early morning here, which may explain why I'm struggling with the technology. Thank you for inviting me, Rui, and look forward to the discussions. First, I'm going to cover a few things in our discussions for today. Why we need to collaborate with industry and governments, and what the challenges are that we face in those collaborations. What are things that would make it easier for the collaborations to succeed? And then I'll talk about some examples of the collaborations between governments and industry or private sector that I have been involved in, and some key lessons that actually made those collaborations succeed. First, why do we collaborate? Collaboration is really about partnership. And at the core of it, the fundamental thing is sharing and teamwork. And these are all the key attributes that really make the collaboration successful. And there has been conceptual and empirical studies showing that really when we work together with governments and private industry, this is good for humanity in many ways. First, one would argue that given what's happening today, our collaboration is really necessary because our survival depends on it. Without the collaboration from governments and industry, we would not have been able to actually come anywhere near close to fighting this pandemic. If you see all the efforts that have been successful to date, or vaccines and so on, is simply because of the collaborations between industry and governments, and of course, academia being at the core of designing many of the clinical trials that are happening. This has been an unprecedented partnership between governments and pharmaceutical industry with Pfizer, Moderna, Johnson & Johnson, AstraZeneca. All these vaccines that are taking place, they're only taking place because governments and industry and academia came together to try and solve the problem. Secondly, there's mutual benefit among partners whenever this happens. There's a lot of empirical evidence showing that communities benefit, academia benefit, industry benefit, governments benefit. So everybody really gets to benefit whenever collaborations happen. And we'll try and see what are the core things that really make these benefits happen. It is also good for national economic development. There's not a single country that has been able to advance without core partnership with private industry or even academia as the think tank that enables economic development. Certainly, it is also necessary for national implementation of knowledge for advancement of public health. A lot of what we do in public health in the form of guidelines, it's all based on evidence, and that evidence is often generated by academic research. But in order for this to really take place at the community level, there needs to be a very, very strong partnership between governments through their public health offices and academia. Certainly, it also enhances academic impact of research. At the core of doing research is really to advance human health or human social health in many ways. But without the partnership of governments, we will not be able to see the efforts or the impact of the efforts of research. So definitely this is absolutely essential in order to actually make things happen. All right, so public engagement in many ways with decision makers is part of really how this really works. It facilitates sharing of ideas, certainly envisioning change and leverage to use evidence-informed decision. We often talk about evidence-based decision-making with many governments, and it's simply because of the partnership that happens. But many times there's a lot of challenges that take place, which is why sometimes, despite all our best efforts, it is incredibly difficult to collaborate with governments and industry. There has been several studies showing that these barriers actually are real and they can take place. First, some academics complain about loss of academic freedom, right? Which it is not surprising that sometimes when you're working with industry in particular, issues of intellectual property come in, and therefore there's not a lot of liberty to share the progress as much as people would like to share. And therefore, sometimes academics complain about this being a barrier. The second thing is there's always several factors that are at the institutional or even person to person or project level that actually make these things difficult to do. Sometimes there's not a lot of flexibility, and there's a lot of also mistrust between partners, and that mistrust is really at the core of why even teams can work well. Sometimes the project clarity is not existence. In other words, it is not clear what the real project objectives are, or there's not really alignment between the objectives of the university, the objectives of the government, or the objective of private industry. We're lucky that for COVID, this is affecting everybody the same way that the objective to solve it is really aligned at all levels. But in many other settings, it takes time to really align the objectives of all the parties to make sure that this happens. Sometimes it's just, the difficulty of being aware of what framework would be used to make the collaboration work happen. Many years ago, I think it was 2017, when I came to talk at the clinical symposium on research in Brazil, not for beginners. And Professor Benedito invited me to actually speak at this. And what I spoke at in this case, it was about barriers that were about really building clinical research capacity. And we looked at the literature at the time, and we found that there was certainly a lot of barriers that happened. We identified several barriers that included insufficient funding, insufficient use of evidence in practice, limited government and regulatory capacity, and fragmented research systems, inefficient administration and management, inadequate material capacity, insufficient networking among the parties, limited human capacity with knowledge and skills, including practical experiences, and lack of leadership in many ways at different levels, and also not having enough mentors and role models to actually make some of these things happen. Or even just a culture of doing research that was happening, or even just low motivation that could be explained by many reasons. What I found out as I looked into this, many of these barriers apply between academia, industry, and government when they collaborate. In many cases, these things don't only happen in low-income countries, it happens in all countries that these barriers tend to stifle collaborations. But what are the facilitators that often make things happen? We looked at the systematic review of the literature, and it shows that there's really several things that have shown to actually facilitate collaborations. One of them really is, making sure that research address local needs. And definitely there's local ownership and leadership so that things can actually be done well at the local level. Whenever we assess local situation and needs, and the partners and stakeholders determine the agenda. And of course, you can identify local champions and leaders so that whatever collaboration is being done is done specifically to address those local needs with local champions as really taking the leadership to make sure that the agenda is set up appropriately. Second thing, that the use of research evidence in practice and policy is a critical component of it, right? That means really we have to then build capacity among government users of evidence and policymakers, and certainly try to make sure that work integrates regulatory and legislative and policy frameworks that make the collaboration work. But most importantly, also to establish platforms to support the evidence uptake at all levels, and fostering that dialogue between the partners, the university, the community, and the government, including industry partners where that also is possible. Thirdly, establishing that build a strong partnership also really ensures that we have the support of the funding agencies or the federal government, if that's what provides the resources to support. So engaging funders early, because many of the things we do require resources, and funding sometimes is a major problem. So we need to engage the funders right at the beginning of the partnership, and determine all the funding priorities, and of course work with them to be able to make sure that if there's going to be peer review of funding for these resources, then there needs to be a system well put together that engages everybody to actually make sure that the funding addresses all the things. For instance, in Canada, whenever we really have partnership engagements that are funded by the government, we would often have people from the academia, from the Ministry of Health, or the public, and from industry who are really part of the peer review system. So this really helps to be able to actually engage the public through our national press or even the international press to really make sure that there's mobilization of public support for the agenda. Now, the other thing that's equally important is mentorship. Always trying to make sure that whatever we do, we're always providing an opportunity to build capacity for the next generation. Certainly, I see whenever people who are experienced researcher or partners with government are working, they should always take the advantage to bring younger people, junior people, to be part of that program, so that they can see by being part of the discussions and learn how to really engage other partners. This really provides an incentive for collaboration and perhaps builds a culture of engagement with government and industry. And of course, it also provides platforms for exchange of ideas and cross-fertilization across all the different partners. But engaging younger people actually ensures that these things will actually survive for the future, because you're already nurturing natural networks with among young people at all levels. So this also provides an opportunity where even programs that are set up in academic institutions could be done such that there would be arrangements for placements or internships with government or industry to allow trainees to also understand the culture that happens in government when they're looking at policy, and the culture that happens in industry, so that even if they decide to work in academia, at least they understand those cultures so that they can work with them very successfully. Institutional leadership and environments are equally important, especially making sure that there's infrastructure at the institutional level, especially within academic institutions, to facilitate these collaborations. But one of the most important things is to align the incentives with the goals. If we don't reward collaborations, people may not take collaborations very seriously. In fact, they may not actually engage in collaborations because they take time, they require effort. So institutions really need to find incentives and reward systems that actually reward collaborations, because this is really one of the ways to actually nurture and foster it. The curriculum needs to really be collaborative and therefore align with the needs of the government, the needs of the industry, the needs of the communities, because everything that governments do is really for communities. So fostering these cooperations and experiential learning is actually essential at the institutional level. Now, I have been involved in several efforts myself where there has been collaborations. So I'm going to share some of the examples where I've been involved, and perhaps some of the lessons that we can take from these collaborations to actually see that they can happen. So what I'll do in this section is I'll share about maybe 6 projects. I'll share the purpose of the collaboration was, who were the industry partners or government partners that worked with us, and what are the things that really made the collaboration to work successfully. All right, the first thing is the ADAPT program, which was developing AIDS prevention trial capacity in Africa. And I'll tell you what we tried to do. This was actually in sub-Saharan Africa with 10 countries that were involved in the collaboration. And this was actually an effort funded by the Canadian government. And this was in collaboration with the government of Botswana. And we had an NGO which was part of the initiative, had established the program, and they were working with me and one of my colleagues who was also based in Ottawa. So this was really trying to train members of parliament of Botswana in evidence-based planning. This is actually the current president of Botswana, but at the time when we actually started the collaboration, he was the minister to the president's office. And previously he had been one of our fellows in the program. And when he joined the government, he was really very determined to make sure that all members of the parliament really understand how to use evidence. So he invited us to actually see whether we could work with the government of Botswana, and he facilitated this, and he was a champion to see whether we could actually do that. So there were 3 of us who were actually invited to come and teach members about evidence. So we're teaching them how to use evidence when they make decisions, and trying to get them to understand the basic language of evidence and how to interpret that evidence, and what type of questions they need to ask academic researchers who present evidence to them, so that they can fully understand what they did and what the evidence really means. So we really taught them about the relevance of evidence to their setting in Botswana, and how to ask about issues of the quantity of that evidence, and most importantly, the quality of that evidence or the strength of that evidence. So all these things were intended for them to be able to understand whether the evidence that they had about prevention of HIV in their own setting would actually be relevant? Would that be good quality evidence? What is the strength of that evidence? Does it include the kind of evidence that one should worry about, and so on? So this was really a fully fledged program intended to train them. And the feedback showed that this was incredibly successful. Why? Because they had a local champion. So the president now, he was the minister at the time. He was really the champion behind this. And because he was one of our trainees from the program, and he understood the utility and the importance of that collaboration. The right thing was that it was at the time when the country was engaged in policy debate about prevention of AIDS, but many of the members of parliament didn't really understand the evidence, and he wanted to make sure that they were really engaged in understanding the evidence. So all the MPs were definitely incorporated in the training and had to understand the importance of doing it. But one of the things that make it happen was because Botswana is really a well-functioning democracy. It has a parliamentary system that functions well. There's very little corruption within the country, and that really made it possible. We did actually write about it, and we published some findings about what we did in Botswana and that. So if anybody's interested, they can read more about it. Now, the Connecting program. This was actually done here in Canada at McMaster, and this was a partnership between the Canadian government and various universities in the country, and also we have some international partners that were part of it. So what were we trying to actually do was actually build capacity in cardiovascular and diabetes trials across the country, and we invited a lot of other international partners to be part of this effort. And as you can see, we're really trying to look at the entire spectrum of prevention, perioperative programs, and really even treatment programs across, including really building capacity in many areas that had to do with knowledge translation and biostatistics and other areas such as health economics. We even really published some of the efforts and strategies we're using in building capacity in biostatistics methodology for HIV, for cardiovascular and diabetes trials in particular. Now, the CTN International Fellowship Program, that's another one I've been part of, and this involved collaboration between the Canadian government through their funding mechanism, which is done by the Canadian Institutes of Health Research. And this is also a pan-Canadian effort, which is universities across the country. But we also have partners from industry who were actually supporting the program because the resources that we had from the government were not sufficient for us to be able to do this. So we engaged a lot of pharmaceutical companies to help us. So what is this about? It's really a partnership of everyone in the country who's engaged in HIV prevention, treatment, and management. And this included researchers across all universities, caregivers in all healthcare settings, and of course the government or even advocacy agencies and groups and so on. This was our first international fellow from Cameroon. And then from Cameroon, it really this spread out to many other countries across Africa. Sorry. Now, the next example is the DSECT program, which was really about drug safety and effectiveness. And this was a training program which was also funded by the Canadian government. And this was really about building capacity in drug safety and effectiveness. And the idea was really to look at what the provincial needs were. We have 10 provinces and 3 territories in Canada, and they were the ones determining the agenda. All drugs are covered by the province, in terms of elderly people, but what to cover because it's effective and it's safe, it's really governed by regulatory bodies that look at the evidence and so on. The issue was, could we actually see whether we could build capacity such that whenever a province has needs, then the drug safety and effectiveness group could actually look at the literature and the systematic evidence, and then help the province address the issues and so on. So we trained a lot of people across the country on a broad range of concepts about drug safety and effectiveness. And the idea was really to develop the depth in knowledge and advanced skills in drug safety. We really strengthened how different universities actually train and mentor them and make sure that the environment was good for them to succeed. This was really a collaborative effort in research in drug safety and effectiveness, which was across the entire country. And the idea was really to make sure that the training also incorporates ethical aspects of doing drug safety and effectiveness, including developing a network of mentors and trainees that could actually collaborate anytime there's issues to be addressed. So this was a really entire team of people who were interested in doing this across the country. It involved people from all walks of life, from biochemistry, molecular medicine, pharmacology, internal medicine, nursing, epidemiology, biostatistics, and geriatrics across the spectrum. So, and we did write about the effort in terms of how we build the program together if anybody's interested in the details. The fifth example is the African Center for Biostatistical Excellence, which we developed in South Africa. This was in partnership with the Stellenbosch University in South Africa, and it was funded by the American government through their NIH program. And this involved a lot of sub-Saharan region partners, which were part of it. And me coming from McMaster involved, of course, the McMaster partnership. So these were all the countries that were involved in designing the program. I was invited to actually come and facilitate the discussions about building the program in South Africa. And we met for about a week trying to figure out how to best approach this. And then, of course, we wrote down the plans of how to do this. And then, based on this plan and proposal, we then took it to the American government to ask for funding. And then actually the program was funded. The last example which I'll share is another effort, which is a consortium for advanced biostatistics, which is also based in Africa and sub-Saharan Africa. But this one is funded by the British government through the Wellcome Trust. And it also involved lots of partners in the sub-Saharan region, which were part of it. But we also had a collaboration with the London School of Hygiene and Tropical Medicine, who were really a very strong partner in building the program. We had lots of countries that were involved, where we had the institutions, academic institutions that were part of this, in the Congo, Ghana, Kenya, Malawi, Namibia, South Africa, Tanzania, and Uganda and Zambia. And we just put together all the details about the program, how we did it, and what we've done so far, and so on. So this paper actually is just about to get published, which provides the details of the program. And we really cover lots of discussions about which universities are involved, when they started, and do they have a master's or a PhD program, and how many staff members do they have, and who are the external partners that they have with the program. And you'll see that the London School of Tropical Medicine is really a key partner. So is McMaster. And we also have another university, which I forgot, which is Hasselt University as well. Now, where do the students who are in these programs come from? Various countries within sub-Saharan Africa. But we co-supervise some of the students with partners from the different countries. Lastly is the Together COVID trials that were done, and these trials, I've been part of these trials from the beginning when we're designing them, and actually two places, one in South Africa, one in Brazil. And I'm talking about the Brazilian ones because really the key one was really a partner between the Brazilian government, the Canadian government, and the American government at the same time. And this was actually funded through the Bill and Melinda Gates Foundation. And we had industry partner Cital, who was also instrumental in actually helping us to be able to use platform mechanism to be able to design the trial. And then we have colleagues from Stellenbosch in South Africa, and of course, University of Washington, who is also part of the partnership. And Jimar, whom you know very well, really was the champion from Brazil, who actually made it happen to get Brazil to be a core partner for this. And this was really using platform design to be able to assess the effectiveness of various treatments for high-risk patients within 48 hours of being diagnosed with COVID infection. Now, the trial was stopped early because of futility. The recruitment went perfectly well, but we didn't see any effect, and the DSMB actually recommended stopping the trial. And we're currently working on the publication for the trial. Now, what were the lessons we learned from these examples, right? The common features was, one, there was a very, very strong local leadership, and every one of them actually had a local champion that was actually championing this cause. For many of the things that we did in Canada, we had specific local champions that were actually spearheading the initiative. Capacity building was locally contextual. In other words, when we're building capacity as part of the program, we were trying to address the local needs of capacity building as part of the program. Mentorship was a major component because it's always good when you include mentorship because you're already building for the next generation to take over. Collaboration between people from different disciplines, cross disciplines, interdisciplines is essential because that's how we really learn from each other. If we didn't understand issues of policy because of the involvement of policymakers from government, that allowed us to be able to understand their language. We can also understand the language of industry partners because we involve them right from the planning of the collaboration, not just when we need money from them. So good partnership from everyone was important. And we involved the partners in actually discussing the ideas from the beginning. Really, for anyone to feel like they are really true partner, you don't not need to involve them at the time when you need something from them. You involve them from the beginning when you're trying to put together the ideas. Then they can really feel that they're really part of the partnership. So really, these things became well-funded because the funding partners were involved at the beginning when we were actually conceptualizing the partnership. I'm just putting all these things in Portuguese in case anybody wants to get a feel of it, because I think it's essential, if anything, to get this as a take-home message. But anytime when you have human beings coming together from different disciplines and different walks of life, industry, government, and academia, there's human elements that are essential to this. First, people got to be passionate about what they're trying to do. So you need people who are really committed at all levels and from all the different sectors for this to happen. But we also need to have empathy for our partners because there are many other barriers that we may not understand that government people face. And there's a lot of other barriers that people from industry that also face. So empathy is absolutely essential at the human level for us to be able to understand where they're coming from. But the other thing is we need to be unselfish, because if it turns out that, we are always thinking about what's best for the university, it doesn't help, because anytime when we're thinking about what's best about the university, we need to be thinking what's best for our partners. Is that kind of unselfish attitude that will actually get our partners to also feel committed. So there definitely needs to be openness and transparency, because that's what builds the trust, right? But certainly there's lots of other things that we don't know. We don't know what happens in government. We need to be patient. And certainly when we don't know and don't understand, we need to ask and ensure that we really trust them to be able to guide us. So these are really the things that I think, we need to take into account. I'm just putting them here in Portuguese so everybody can see what we're trying to summarize. All right. Finally, I would say, among everything else, trust is absolutely essential. It takes time to build trust. And certainly, I would say building that trust and the relationship, it needs the investment. And sometimes it's investment in time, investment in resources, and it's worth it when we take the time to build that trust among the partners, so that the trust can really make sure that it facilitates the goals of the partnership. All right, I'll end it here with wishing everyone happy holidays and a Merry Christmas. This is a big, giant, movies that you'll see when you're in Niagara Falls. So unfortunately, people can't travel these days, but we can bring Niagara Falls to you. I thought I should show you what's happening in Niagara Falls now during Christmas holidays. Merry Christmas to all of you and your families. I hope you all stay safe, and I wish you very best for 2021. That we'll all have good health and hopefully solve this pandemic in ways that will allow us to communicate again and give each other a hug, and wish everyone peace during the holidays. And with this, I will stop, and obrigado. I'm done now, and I've stopped sharing.
Sorry. Thank you very much for your brilliant conference, Professor Lehana. Your words encourage me and, of course, my colleagues to continue in this way, to collaborate with different colleagues, different professionals of other institutions. I have a question to you that is very important for us, because yesterday we had a round table about intellectual property, okay? And this is a critical step that many times it's a problem between the public and private initiatives, okay? And we have in Brazil masters and PhD to professionals directly to industry collaborators, okay, that came to the university to study some and solve maybe some problem of this industry in particular, and how is making to to involve this ecosystem between the interests, private interests and the public interests, mainly in the intellectual property.
Now, I'll give you a bit of description of how it happens in Canada. It is one of perhaps the most challenging aspects of inter-collaborations between government, industry, and academic institutions. And it varies from institution to institution, which is a bit what happens in Canada.
Sorry.
Yeah, okay, I just feeling an echo. Mm-hmm. So the unfortunate aspect is that there is no coherent framework that's used to make sure that all academic institutions have the same framework when they're thinking about intellectual property issues in collaborations. So it's all over the place. Every institution has their own intellectual property policy, and even at the government level, it varies from province to province. Even within the province, it varies from jurisdiction to jurisdiction. And when it comes to private industry, it varies from company to company. So it's all over the place. There is no really cohesive framework that everybody uses. Now, the unfortunate thing is, in many cases, to be honest, it is what stifles collaborations. That's why people are reluctant to go into collaborations, because they're afraid that their intellectual property will then be taken by a partner who has resources, and they're not going to get anything out of it. So, if anything, I would say it is perhaps one of the areas where partnership could actually begin to come up with, a very cohesive strategy of how to deal with intellectual property issues. But we are all aware that it is really the source of mistrust. So why not make it the first item when we start the collaboration? Mm-hmm. But also, most importantly, when we make it the first item when we discuss collaborations, is to always be open to making sure that there's a win-win scenario. The problem becomes when one partner wants to get all the credit without allowing other partners to get the credit. So it is important to approach this and build it such that there's a win-win scenario for all partners, which is why all those human aspects come in, of making sure that, first, if we are individual humans around the table, let's make sure that, our partners are happy. Then we can think about institutions. If we can't help each other to be happy in the discussions, and think about where I'm coming from, where my industry partner is coming from, where my government partner is coming from, we can actually then help the institutions. Now, remember that institutions really are nothing else but humans, which is why the human elements of the collaborations are incredibly essential. Now, think about it. How often do we actually incorporate the soft skills when we train people? We don't often actually train them in soft skills. They learn them through trial and error, right? So I certainly often encourage a situation where part of the training deliberately and formally introduces soft skills that are necessary to create strong collaborations, right? Because it is that beginning that would actually help us to deal with some of the difficult elements, such as intellectual property. I mean, all these policies about intellectual properties are made by human beings. If we can actually learn how to communicate effectively with each other, how to collaborate effectively with each other, we can actually create policies that facilitate collaboration at all institutions.
Okay, great. Thank you. I believe that if you can get these points before to start it, okay, we will be easy. But what happened in Brazil right now is that we have a lot of juridical insecurity, okay, because the relationships between public and private are not totally solved, okay. And I agree with you when you said that we put efforts to form ability, skills in the people, in different professionals, and this approach. How your main tip is, okay, to do different minds work together. This is the big challenge.
But I often say we're lucky in academia. Why? Because we train people who work in government. We also train people who work in industry.
Yeah.
Right. So we are actually the best positioned to actually change attitudes. So what is essential is make sure that when we train these people, we also train them in ways that actually gets them engaged and understand the culture of industry, the culture of government. So experiential learning through core programs is absolutely essential. We need to bring people from industry to come and teach in the program. We need to bring people from the government to come and teach the program, because ultimately the people we are training, they are the ones who are actually going to be running the government. They are the ones who are going to be running industry later on. So if we can train them in ways that make them appreciate the different cultures, and the importance that we need strong industry for academia to survive. We need strong governments for academia to survive. Then we are building a generation of leaders who are going to work in government and industry and academia who will learn to work together. So, I mean, we should never underestimate the privilege that we have as academic institutions, that we can actually shape the future that we want by making sure that we train the people in ways that will make them the kind of leaders that will learn to work together. I mean, every single one of the people who work in government and every single one of the people working in industry, they all went through academia before they got there. So, but we have to recognize this, that we have the power to change it. But a lot of this can happen if we change the way we train them. Right? Now, the problem is we're not very good the way we train because we don't understand government. In fact, we even in many cases, I've seen this happen. We actually don't speak well about the government. We also don't speak well about industry. And so people who finish from academia leave academia thinking that, academia doesn't think working in industry is in the best interest of society, which is really not good, because we need very strong private industry that can really help to support some of the research efforts with funding. So they are really good partners, but part of it is because we in academics, we have never been trained how to work together with them. So we don't know how to work together with them, and therefore we don't understand them. So I think the kind of training that really would ensure that our trainees understand government, they understand private industry, and bring them in, take them out to go work in industry before they finish for a few weeks or a few months, bring industry people to come and teach in our programs, determine what the needs are together. Very rarely would you see industry and government people involved in development of curriculum. Why can't we bring them in to actually discuss the curriculum together? So it is that kind of trust that we need to change the attitude. Then I think everything is possible.
Yeah. So summarizing, I believe that we need to learn to hear. Okay, hear the interests of government, of the companies, because they of course they have different interests, but I believe that these specific interests are totally different of the academia. Okay.
Yes.
We need to hear.
I was just going to say they're very different, but we shouldn't look at different as bad.
Yeah, yes.
Different is good, because if industry is interested in creating profit, they often use the profits to support communities.
Of course.
So we really think like we need to foster that difference, because I mean, one of the things that our Prime Minister often says here in Canada is our differences are our greatest strength.
Okay. Professor Alejandro, we don't have more time, unfortunately, and great to see you again. Since on distance, I believe that in a few months we could invite you to visit us in Brazil again. It will be a pleasure for me, for our team, and of the Faculty of Medicine. And thank you for your brilliant, awesome words that encourage me and our team to continue in this way, because it's very different for us. It's different of its practice in the academy. Some people are not comfortable with this situation because it's a break of paradigm, maybe for some people. And but I believe that this relationship between government, companies, and academy is necessary to Century 21. It's absolutely necessary. And your lecture was brilliant in this specific point. And this lecture was recorded, and of course I will use this lecture in my another lecture to my students to encourage other people. And thank you very much. Please, your last words for us.
Thank you so much for inviting me to be part of the discussions. One of the things I miss most is visiting Botucatu. It's always been one of my annual special treats, because, and I always like to visit when it's winter here. I come to Brazil, it's nice and sunny. We all have to take vitamin D supplements here because we don't get enough sun in winter. And now I always say, I wish I could visit Botucatu during this time. But we are very fortunate that because of what we're discussing today, which is collaborations between government, industry, and academia, we are very likely to find a solution to this problem. This pandemic is not going to last forever, and we can see the benefits of working together with industry partners and governments. And I hope people will take the lessons from this pandemic to really nurture some of these relationships and to let them continue and flourish. I applaud you for really keeping the engagement and continuing on this discussion. I know that you guys are incredibly committed to changing the status quo to strengthen these partnerships because you see the importance in them. If you show your importance like you're showing in your leadership, your students are learning from you. You're becoming role models about how to actually approach this issue because it's essential. Brazilians, communities depend on it. If anyone ever had doubts about the importance of this collaboration, let this pandemic be a lesson that without this collaborations, nothing. We would all disappear. I mean, see how many people are dying around the country, different countries. But we're able to actually get there because of these partnerships together. Imagine if we build a culture of training where we actually nurture and foster this type of collaborations as part of core training, what our students could actually achieve in the future. They wouldn't have to worry about the challenges of collaborations because collaborations would come naturally because it's part of the way of living. So I wish you well. I wish you safe Christmas holidays. Please continue to stay COVID-free. And until we meet again, hopefully in the near future. And I always, miss Botucatu and friends there with fond memories. But hey, we are fortunate. We live in a planet where nothing lasts forever. So this too will pass. And thank you again for inviting me to be part of the discussion. I wish you well and look forward to further engagements in the future.
Thank you again, Professor Alejandra. I'm very, very happy for this great discussion this Saturday morning. And we are finishing this session on the time, 10 a.m. For us in Brazil, of course. And thank you for audience on YouTube. Thank you for questions. And Professor Alejandra, thank you again. See you soon in the next months. Okay, take care and with COVID-19.
Thank you.
Bye. See you.
All right.